am going to ask Congress to send me a bill to immediately repeal and replace disastrous Obamacare. We are going to repeal and replace Obamacare.
If it sounds familiar, it should. It has been the mantra of the Republican Party and of President Trump for more than 9 years now, ever since the Affordable Care Act, or Obamacare, became the law of the land. But even though Trump had Republican majorities in the House and the Senate, he couldn't get a repeal passed. In the GOP, they've never come anywhere close on a replacement model for the existing health care law. But now, an appeals court in New Orleans may do what Trump, Mitch McConnell, Paul Ryan, and every other Republican seemingly in D.C. couldn't do. That's kill Obamacare. And the court appears posed to do just that. In a case brought by a number of Republican states and backed by the Trump administration, the two Republican judges on a 3-judge panel, they've asked very pointed questions about whether the law can remain on the books now that the penalty for not having health insurance has been removed. Well, the reporter who wrote that piece for the Washington Post and has covered this case here and its potential impact from the very beginning joins us now. That's Amy Goldstein. Again, she joins us from D.C. with more. And Amy, I know a lot of people obviously focused on the Gulf right now with the storm bearing down, but there was significant movement in the Fifth Circuit down in New Orleans that could impact nationally millions and millions of people relating to health care. And we got an idea, at least, didn't we, in the window of the opening or the oral arguments that were made. There's skepticism on at least 2 of the judges' parts of the 3 as to whether or not the AC as currently constituted should survive.
That's exactly right. What happened Tuesday in a courtroom in New Orleans is an appeal of a lawsuit that's actually not the first lawsuit by opponents of the AC trying to get the law struck down. The Supreme Court in 2012 and 2015 upheld this big healthcare law's constitutionality. But about a year and a half ago, a group of Republican attorneys general filed a new lawsuit challenging the ACA, and last December, a federal district judge in Texas ruled that the entire law is, in his judgment, unconstitutional. So that case is now on appeal, as you say, to the Fifth Circuit, and Tuesday was the oral arguments in that case.
Now, Amy, this all comes down to really the insurance penalty, and the attorneys arguing from the Democratic perspective said, hey, listen, Congress eliminated the tax penalty, made it 0. The thing should be kosher right now. It's a non-issue anymore. But the arguments, and seemingly with receptiveness for the judges, said that doesn't cut it. Explain how the insurance penalty at the end of the day is the big issue here that these judges have to figure out whether it still holds merit.
Right. Well, in 2012, the first time that the Supreme Court ruled on the ACA, Chief Justice Roberts said that the law was, who wrote the majority opinion, said that the law was constitutional because the part of the law that said that people who don't carry health insurance face a federal fine, a federal penalty, that penalty was legal under Congress's taxing power. Now, fast forward to the end of 2017, when now a Republican Congress, as part of a big set of tax changes, took out that penalty and lowered it to 0. So there's now no penalty for people who decide that they don't want to have health insurance in the United States. So the people who are trying to get the law thrown out now are arguing that if that penalty is gone, then the taxing power that the Supreme Court said was the reason the law is legal, is constitutional, that argument no longer holds. And as you were saying, the 2 Republican judges on the Fifth Circuit's panel of 3 judges who are hearing this appeal now, they were asking a lot of tough questions of the Democratic attorneys who are trying to preserve the law about whether that was really true or whether without this penalty, the law couldn't be considered, at least the part of the law that required people to pay a penalty could no longer be considered constitutional.
So, Amy, now let's get into the potential consequences both from the practical and the political, and start off with the practical. How many people, how many million Americans could be impacted if in fact the judges say, no, this is no longer constitutional the way it's currently constructed, it's gone? What would happen? How many people would be impacted here, and in which ways?
Well, there are millions and millions of Americans who would be impacted, and they fall in a couple of different groups. There are about 11, 12 million people who have gotten insurance through new marketplaces the ACA has created for people, for families who buy insurance on their own. So that's one group. Those marketplaces would disappear, along with federal insurance subsidies that most of the people buying coverage in those marketplaces now get. A second group of people would be low-income people in 36 states that have expanded Medicaid under this health care law. That expansion would also vanish. And then beyond those two groups of people, the law provides many kinds of insurance protections, consumer protections, for most people who have any kind of private health plan. So for instance, it says that people who have pre-existing medical conditions can't be discriminated against by their insurance companies. The law says that young adults can stay on their parents' health plans until they reach the age of 26, older than used to be the case before this law came into existence. And there are other examples, but those are some of the ways that the law going away would have very quick, very dramatic effects on many people around the country.
Politically, Amy, wouldn't this potentially be the ultimate example of a Pyrrhic victory for Republicans, that finally they get to repeal the ACA after doing all this trying? But now, unlike when it was first enacted, this thing's really popular, and it's not just for the folks in the blue states or the blue voters. A lot of their own electorate here would be really harmed by it, and they've actually touched it, felt it, they've used it, they rely on it. It would be taken away, and clearly Republicans would be blamed for it. How are Republicans on Capitol Hill feeling about the possibility they might actually get what they want?
Well, that's a good question. Public opinion has always been quite divided over this law. At the moment, it's a little more popular than it was some years ago, but only a little more than half of the American people in public opinion surveys say that they like this law a lot. But there are parts of the law, such as the consumer protections, that many people really appreciate. And as you say, this could put the Republicans in kind of a tricky political spot if they succeed in getting rid of this law, as they've been trying to do for years now. The reason is that if you think back to 2 years ago, when the President Trump was newly in the White House, you had Republicans in control of both the House and the Senate on Capitol Hill. There was a big congressional effort to repeal the ACA, as many of your viewers will remember, and try to create some alternative to it. And Congress could never manage to do that. That effort failed. So if this law is struck down by the courts, then that raises the question of, okay, what happens next? And as you suggested, it's likely, I'm not a very good political prophet, but it's likely that the Democrats running for office in 2020 would say to the voters, people they hope will be their voters, hey, Republicans, you were the ones who got rid of these protections. What are you going to do next? And it hasn't been very easy for the Republican Party legislatively to figure out what to do next. So that's a bit of a wrinkle.
Finally, Amy, speaking of the Democratic candidates for president and also some notable members of the freshman class, Medicare for All. Talk about them. I know you've looked at it. The feasibility of such a program, let alone the political appetite. Is this an interesting idea and only that, or do you think there's any will, let alone any economic model that could support such a system?
Well, that's a good and a hard question. Again, if you look at what people say in political polling, if you just ask people, do you like the idea of the government having a bigger role in health care, most people say yes. But if you ask about some of the trade-offs that would be required, for instance, under a true Medicare for All system, private insurance by some of the candidates' ideas would go away. People would have to change away from the health care coverage that they now have. If you throw in some of those complexities, support goes down considerably. So it's early in these Democratic campaigns. Some of the candidates on the Democratic side have laid out exactly what they think they would want with the Medicare for All system. Some have been a little fuzzier about their intentions. So there's a long distance to go to see both how this will play out in the campaigns, and if it ever were to be that the next president is Democratic, how this would play out in policy terms.
And obviously, all these questions impacted by what happens in New Orleans. Amy Goldstein, thank you so much for the time. I really appreciate it.
Happy to talk with you.
Up next on RFL, the chaos of Donald Trump and his administration. There's always a scandal, always an outrageous comment, always people offended, and always smacking back at insults, no matter how petty. But a new book says that, believe it or not, is by design. We're going to speak to the author straight ahead.